Namaste everyone. Today I will be talking about complications of hypertension or high blood pressure. In earlier videos, I have shared the information how to identify high blood pressure or hypertension, what precautions we should take and what medicines we should be taking to control the blood pressure. Now in this video I will share the complications of hypertension, in the sense, if you do not control the blood pressure well, what will happen, what will be its adverse effects on your body. Now there are certain risk factors for complications for hypertension. The common one is smoking, cigarette smoking. If you smoke, the complications are going to catch you early. The other ones are diabetes, obesity or cholesterol. Now what are the complications? The first complications which we will discuss is related to heart. Now in heart there can be a heart failure. What is heart failure? If there is a severe high blood pressure or hypertension, it will cause the heart to pump ineffectively or inefficiently, which will cause the fluid to accumulate or the liquids to accumulate in the lungs, in the legs, in the other parts of the body, which is called as heart failure. The other complications for heart is coronary artery disease or heart disease, which commonly is known as heart attack. So someone who has a high blood pressure for long time, they tend to develop clots in the blood, and that actually triggers or cause a heart attack. The other complications of hypertension on heart are left ventricular hypertrophy. The wall of the ventricle, the wall of the main ventricle or main part of the heart becomes very thick because of the high blood pressure. Now this left ventricular hypertrophy itself will cause lots of complications in the future. That's why the blood pressure control is very important. The next complication of hypertension will be on the brain. In the brain it can cause multiple problems. It can cause clots in the brain which can lead to stroke. It can cause burst of vessels in the brain which will cause intracerebral bleeding or intracerebral hemorrhage. It can also cause retinopathy. What is retinopathy? If there is a long-standing or uncontrolled hypertension, it will damage the blood vessels in the retina. Now what is retina? Retina is one of the most important part of your eyes, and if there is a retinopathy or if there are some bleedings or exudates in the retina, your visual will definitely be affected, and you may have symptoms and complications related to your vision. The next complication of hypertension will be on the kidney. It can cause multiple problems. One of that is or the commonest one is chronic kidney disease and end stage renal disease. What is chronic kidney disease? It's a progressive damage happening in the kidney, and when it reaches at its peak, it will cause end stage renal disease or end stage kidney disease, when the kidney function is going to be less than 10 to 15%. That is when the patient will need dialysis or kidney transplantation. The last complications which I will discuss is peripheral arterial disease or peripheral vascular disease. What will happen in these blood vessels which are in the periphery? Now most of the complications which we discussed were in the major organs like heart, brain, kidney. But what happens to the blood vessels which are in the periphery? In the peripheral blood vessels, blood clots develop. It is called as atherosclerosis. And what may happen is, because of the atherosclerosis, patient or person may develop gangrene of the legs, it can develop ulcers in the leg, it can develop reduced flow in the limbs. It can also develop a reduced blood flow to the internal organs like stomach or intestine, and that will lead to its different complications. Now, the risk for complications related to hypertension usually starts as early as when your systolic blood pressure is more than 115 and diastolic blood pressure is more than 75. And it is observed that every 20 increase in systolic blood pressure or 10 increase in diastolic blood pressure actually doubles the risk of death because of either heart disease or the brain disease or any other complications which we just mentioned. It's also observed that systolic blood pressure and pulse pressure may be a better indicator of complications in elderly people more than 50, whereas less than 50-year-old people, diastolic blood pressure, the lower blood pressure, is a better indicator of the complications or mortality. Thank you very much.
Hello friends, my name is Dr. Amitabh Kulkarni and this is my YouTube channel Healthy Minutes. It's going to focus mainly on the health issues, health related information. Do not forget to subscribe, and if you have any comments or question, you can enter in the comment box below. Thank you very much.